Which of the following bony landmarks of the skull is an attachment point for the splenius capitis, the longissimus capitis, and the posterior belly of the digastric muscle? A. The mandibular condyle. B. The mastoid process. C. The coronoid process. D. The styloid process. The answer is B. The mastoid process. The splenius capitis, the longissimus capitis, and the posterior belly of the digastric muscle all attach to the mastoid process, a bony protuberance on the inferior border of the temporal bone. This landmark is also an attachment point for the sternocleidomastoid muscle. The styloid process of the temporal bone is directly anterior to the mastoid process, and is an attachment point for multiple ligaments and the styloglossus muscle, the stylohyoid muscle, and the stylopharyngeus muscle. The mandibular condyle and coronoid process are both part of the mandible and do not form any attachments to the muscles of the neck. The inferior alveolar nerve exits through what opening in the skull? A. The foramen rotundum. B. The greater palatine foramen. C. The mental foramen. D. The supraorbital foramen. The answer is C. The mental foramen. The inferior alveolar nerve exits through the mental foramina of the chin. This nerve is a branch of the mandibular nerve and supplies sensory innervation to the lower teeth. The foramen rotundum transmits the maxillary nerve. The supraorbital foramina transmit the supraorbital artery, vein, and nerve. The greater palatine foramen is located in the palatine bone and transmits the greater palatine nerve, artery, and vein. The falx cerebri attaches anteriorly to the skull at what landmark? A. The orbital plate. B. The cribriform plate. C. The ethmoidal labyrinth. D. The cristigale. The answer is D. The cristigale. The falx cerebri, the dura that separates the two hemispheres of the brain, attaches to a bony projection of the ethmoid bone called the cristigale, or crest of the rooster. This projection is a distinct landmark that arises from the cribriform plate. The ethmoidal labyrinth and orbital plate do not form many attachments to the dura of the brain. The supraspinatus tendon passes under what bony projection of the scapula? A. The acromion. B. The superior angle of the scapula. C. The coracoid process. D. The spine of the scapula. The answer is A. The acromion. The supraspinatus tendon passes under the acromion, a bony hook-like process at the end of the scapular spine. Inflammation of the supraspinatus muscle or tendon can quickly lead to entrapment of this muscle under the acromion, causing pain and reduced mobility. The coracoid process, another projection from the anterior scapula, is an attachment point for several muscles and ligaments, including the pectoralis minor and the short head of the biceps brachii. What is the large, fan-like ridge of bone that can be palpated just below the waist? A. The anterior inferior iliac spine. B. The iliac crest. C. The greater sciatic notch. D. The anterior superior iliac spine. The answer is B. The iliac crest. The large, fan-like ridge of bone that can be felt just under the waist is the iliac crest. The anterior superior iliac spine and the anterior inferior iliac spine are smaller protuberances on the ilium that are important landmarks for assessing malpositions of the bones of the sacroiliac joint. The greater sciatic notch is in the posterior ilium and serves as a passage for several muscles and nerves of the pelvic girdle.